There's a lot of talk during the minimally invasive spine block, and I think in session 8 later on you're going to hear a lot about microscopic overview of the procedure I'm talking about, as well as comparison with other surgical procedures. So my goal is to give you a macroscopic view of interspinous fixation today, specifically indications, outcomes, as well as practical techniques to involve this in your practice. I guess the easiest thing to start with in the MISS block is, what is minimally invasive surgery? It is essentially an operative procedure utilizing some form of imaging, whether it's ultrasound, CT scanning, or fluoroscopy. And the goal for minimally invasive in general now, and I think that's a transition in medicine for most procedures and most physicians to move in the angle of minimally invasive spine, is for multiple reasons. One is perioperative complications, avoiding these complications that can be more prevalent in major surgical and open procedures.